Hi, welcome back to the channel. If you're new here, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University, and today I'll be talking about a very powerful evidence-based treatment of depression, which is comparable in its efficacy to depression medication, and this technique is known as behavioral activation. So to outline this video a little bit, first of all, I want to talk about what depression is and what is at least one theory of how depression is maintained or develops over time. And then I'll talk more about what is behavioral activation and how you can incorporate behavioral activation into your life. So in order to be diagnosed with major depression, you have to experience at least one of two cardinal symptoms, either low mood, so feeling depressed or down or sad or hopeless, or anhedonia, which is a loss of interest in things you typically enjoyed or enjoyed in the past. So for example, you might have enjoyed playing guitar in the past or doing art, but nowadays you don't feel the same sort of joy or pleasure anymore. And these symptoms have to persist for at least 2 weeks for most of the day, nearly every day. And along with low mood and anhedonia, you'll also typically experience other symptoms like changes in the way that you sleep, either sleeping too much or not being able to sleep very well, changes in your appetite, feeling either agitated or very slow, like you're moving through molasses, feelings of guilt or worthlessness, feeling tired, difficulty concentrating, and also sometimes thoughts of death. And you need to have at least 5 out of 9 symptoms along with one of these two cardinal symptoms of low mood and anhedonia to be diagnosed with major depression. So fundamentally, depression is somewhat of a self-fulfilling condition because when we feel depressed and we feel unmotivated and the things that used to give us meaning and joy and pleasure don't give us that same feeling anymore, we stop doing a lot of the things that we typically used to do that used to give us a sense of pleasure or mastery or sense of connection. And then as a result of this lack of positive reinforcement in our life, we feel even more depressed. And when we feel even more depressed, we stop doing even more, and then we stop doing even more and we feel even more depressed, and it becomes this sort of cycle of depression where it becomes very, very hard for us to break out of this depression loop. So in cognitive behavioral therapy, we often talk about these thinking errors or these biases in the ways that we think that makes it hard for us to get unstuck from certain disorders like depression and anxiety. And one that I think is very foundational to depression is this idea called emotional reasoning or following a feeling, insofar that how we feel influences what we do and how we think. So when we feel depressed, we're not going to want to go outside, we're not going to want to do anything. But the problem with that is that's where the depression lays its trap, because if you don't do anything, then you never get any grease for your wheel to make you feel any better, and then you get stuck in the depression loop, because what depression tells us to do is essentially to stay at home, stay in bed, not interact with anybody, and just feel worthless all the time, which again keeps us stuck in that moment. So behavioral activation at its very core, as simple as it sounds, is to reintegrate all the things that we have lost as a result of depression and slowly and gradually bring it back into our lives. And there are 2 factors about being human that we can use to leverage this behavioral activation and reintegration of the things that we enjoy. One is that we can do things even if we don't feel like it. Like, I was feeling pretty tired when I made this video, but I still kind of pushed myself to do it. And number 2, our behaviors can actually influence how we feel and what we think. So even though I was tired in the beginning, as I'm talking now, I'm getting more and more activated. I'm starting to actually enjoy and feel actually good doing this video. So when it comes to behavioral activation, there are 5 different types of activities that we can really think about reintegrating into your life. So these 5 buckets include activities of joy, the things that give us pleasure, like drinking a nice cup of tea or taking a nice walk. It could be activities of mastery, things that make us feel competent, like learning a new skill, studying, making your bed. There can be activities of connectiveness, so these social relationships, calling your mom in the evening or spending time with friends. Approach activities, which are basically activities that we are avoiding doing in the moment, like maybe we're avoiding sending an email or doing some sort of task. So those are approach activities when we actually choose to approach and do the things that we're anxious about. And then also values-based activities, and these are kind of personally meaningful activities that really give my life a sense of purpose, that are important to me, and they're going to be very individual to you. And of course, some activities can fall into multiple bins, like for example, if you really enjoy playing the piano or doing art, all of those things could be things that give you pleasure, give you a sense of competence and mastery because you're learning a new song, and they can just be personally meaningful and valued activities because you really enjoy creating. So you don't have to have perfectly artificially binned categories, and some things can actually fit into multiple categories. So for the first step of behavioral activation, one of the things that can be really helpful is to figure out what activities have been lost as a result of the depression. What are some of the things that you used to enjoy or find meaning in, or connection-based activities or things that you're now avoiding because of the depression, and identify what are some of those activities that used to give you that sense of pleasure and increase your mood, and figure out what has been lost. And one way that we can do this formally and in a more comprehensive way that I've used with my patients in the past is something we call the mood activity log, which I can link in the description below. But really the mood activity log is a way to really identify moment by moment, or at least hour by hour, what kind of activities are you engaging in nowadays, and what is your mood rating, from 0 being like feeling really, really poor to 10 being feeling like amazing, because that helps make a connection between what are the activities you are doing and whether or not that influences how you feel in that moment. So this practice can be really helpful because it helps us identify what are the behaviors that improve mood and what are the vulnerable spots or behaviors that depress our mood, so we can kind of be thoughtful about what are the activities we want to include back into our lives in a nice gradual manner, and what are some of the places we could incorporate those to really give you the biggest bang for your buck. And if this feels like a little bit too daunting of a task for you, that's totally okay. You can just sort of think a little bit about what are some of the activities that used to give you a sense of joy and uplift your mood or give you a sense of meaning, and then that can be a way for you to figure out what are some things that could be things that you can add back to your life. And then we can really be thoughtful as to what are the activities that are missing in our lives and what will give us the biggest bang for our buck. So the way that I think about it is that, for example, if you are spending all your time in mastery-based activities, like you're always working, you're always studying, you're always on the go, but maybe you've stopped doing a lot of things that used to give you joy or connections, maybe you're spending less time with friends, those things can give us some information as to where the activity should come from when we're reintegrating these activities into our lives, because we wouldn't want to do more and more activities for mastery because we already have so much of that, but we want to pick the activities that are going to be most helpful in creating sort of a balance in our lives. And when it comes to behavioral activation, I really want to make sure that everyone is set up for success. So one of the things that can be really helpful is to pick the activities that feel like you have a very reasonable chance of success. So you wouldn't want to, like, let's say you want to be more active, you wouldn't want to necessarily go for a marathon every single day, but you might say, okay, maybe I'll take a 5-minute walk every day. Or maybe instead of like trying to do 10 different pleasurable activities, I'll just make myself a nice cup of tea in the morning. Whatever that might be for you, I really encourage you to think about what would be the activities that are intrinsically rewarding, or things that you can feel are relatively achievable given all the things that you're dealing with right now, because we want to set you up for success. So another way to increase your chance of success is to identify the potential obstacles that can get in the way. So for example, let's say you really want to take a walk in the morning and you're thinking, oh, I don't know if I'm going to be able to get out of bed because the bed is so cozy. One strategy you might employ is to put the alarm clock a little further away, so when you wake up you kind of have to walk over there to close the alarm, and by then maybe your joggers are also on the floor, so you can just put on your joggers and your clothes and then you're immediately out. Or you can even reward yourself afterwards and say, if I do this, I'm going to treat myself to my favorite coffee place, and then that allows you to, again, have a little bit more motivation to reach your goals. And as a quick temperature check after setting the goals, I usually like to ask my patients a question of, from 0 to 10, how likely do you think you are to actually complete this task? 0 being not at all likely, to 10 being shut up, Parky, I got this. And usually I'm looking for at least a 7 on 10 because I really want to make sure I'm setting the patient up for success. And if it's lower than 7, usually I'll ask the question, what would it take for you to get to a 7 on 10 or 8 on 10? Because their answer is going to provide very valuable information as to what the barriers are for them and how we can address them. And sometimes unhelpful thoughts or beliefs like, it's not going to do anything anyway, I'm not going to feel any better, all of those things can be potentially true, but ultimately unhelpful in making us be curious enough to give these things a shot. So maybe you can treat them as like a curious experiment and say, well, I'm feeling kind of crappy either way, so maybe I can just give it a shot to reach out to a friend or do something nice to myself and just see if I feel a little bit better afterwards. And ultimately, I do want this video to be of use to you, even if it's just a little bit, and not another random motivational video that doesn't actually do anything to change your life. So I definitely encourage you to do even the smallest thing today, whether it's taking a small walk, making yourself a hot bath or a nice cup of tea, or cleaning your room, or spending some time with a friend, whatever that might be for you. I encourage you to start small to build up some momentum, and you can even let me know in the comment below what you did, and I'll be super happy to hear from you. Anyway, that's all for this video. Thanks as always for watching, and I'll see you in the next one. Bye-bye.